Good day, folks. Alti Vente here once again at Vente Pain Relief Clinic and VPRC.ca. I'm hoping you're having a terrific day. So welcome again to our soft tissue case study. This is the Hockey Hippy Part 2, the answers and discussion portion. Hopefully you got a chance to look at, to watch Part 1 of the case study and take some notes. So now let's get on to this case study. And remember, like, these case studies are for those of you guys that have training and working with the soft tissues. Maybe you specialize in it. Maybe you've got a very, very strong focus on the fascia and the muscles. And this is what these cases are about. So now let's get on to the case study. Your patient client is a 40-year-old male. The patient works as an accountant and sits between 6 to 8 hours a day. Sometimes he brings home his work and may continue for another 3 to 4 hours at home. He formerly was a college-level hockey player, but hasn't consistently played for at least 10 years. His friends have invited him to play in a recreation league twice a week. He has accepted, and I'm sure many of you guys have had dealings with patients that are like this. Maybe they played at a high level, whatever sport they were playing in college or high school, and they haven't played in a long time. All of a sudden, they get that itch to go back and playing. So this is a case of that. He has been playing for 3 weeks now. At the moment, he's noticing pain, tightness, and discomfort in a number of areas that seems to be getting worse. He wants you to fix him. He has not encountered any trauma to the areas of primary and secondary complaints. On the health history, and from your questioning, this is what you have surmised. The primary complaint is of pain and discomfort in the superior anterolateral aspect of the right thigh. He's noticing pain towards the lateral aspect of his knee. He also mentions that he feels pain located around his right sitting bone, the ischial tuberosity. There is also tightness of the gluteal muscles. It seems, this is of course relative to the opposite side, the unaffected side. It seems that the symptoms are constant, but he really feels it spike during his hockey games. He rarely stretches and is inconsistent in regards to exercising. It's kind of like one of those typical weekend warrior type of deals here. You know, there's no preparation, there's no strengthening of certain muscles to help, no work with cardio. They just go straight into the sport. Key observations. So palpations appear to the area just inferior and lateral to the anterior superior iliac spine of primary complaint, produces a bruising sensation to the area of complaint on the right side. There's drastically more tightness to the right gluteals and tensor fascia lata versus the left on palpation. So when you're feeling around the area, you notice that there is significant tightness relative to the opposite side. Deep, pinpointed palpation of the erectors of the thoracic erectors of the right side exhibit a referral into the right ischial tuberosity. So that's an important note there. Further into the key observations, palpation of the lateral aspect of the right thigh showed tightness and tenderness. When performing obers and modified obers, that this is with the knees bent, it is observed that the thigh and leg remain elevated at a 45-degree angle. That's a positive sign. Hopefully, you got a chance to do, again, the first video, and if you weren't sure about obers and modified obers, you could potentially find them in your assessment textbooks. I'm sure you guys probably have them. Performing Thomas test, you notice that the hip is flexed and that the thigh fails to touch the table. That's another positive sign. Also, you notice that the thigh passively abducts, so that's important too. Femoral nerve testing is negative. So now let's get on to the critical thinking questions. But before I go into that, please like, share, subscribe. If you like our content, please like, share, and subscribe. Also, hit that notification bell if you are on YouTube. And another also, if you are an instructor and you feel this is helpful for your students, please feel free. We encourage you to pass this on as an adjunct to their learning. So now let's get on to the critical thinking questions. What is the main structure that is potentially causing the primary complaint? What is your explanation of why your patient is encountering knee pain? Also, describe the pathogenesis, describe how they got to that point. Explain the overall causes of your patient's presentation. And finally, what other strength, length, and special tests might you consider for this particular case? Question number 1. What is the main structure that is potentially causing the primary complaint? Well, this one is, the main structure is that's causing the symptoms is the tensor fascia lata. Secondary is gluteus maximus and thoracic erectors. This is based on your observations, and the case history. So, what is the main structure that's potentially causing the primary complaint? As you can see in this picture here, I've drawn an X on the tensor fasciae lata. In fact, there's a number of trigger points in the tensor fasciae lata, and it refers into the anterolateral upper thigh, the superior thigh, with a concentration more on the superior aspect of the thigh. It also can refer, this trigger point can also refer into the IT band. So you may get a person coming in and they're complaining of this upper thigh pain, going to the IT band, and it's potentially the tensor fasciae lata muscle. Question number 2. What is your explanation of why your patient is encountering knee pain? Also, describe the pathogenesis. So, the knee pain is being caused by extremely tight gluteus maximus muscle and tensor fasciae lata. The evidence is palpatory. That's one piece of evidence. In the case study, there is more tightness on the affected side versus the unaffected side. Both gluteus maximus and tensor fasciae lata blend into the IT band, the iliotibial band. The IT band crosses the knee and attaches to the superior tibia via Gerdy's tubercle. Of course, the IT band is on the lateral aspect of the thigh. The tight glute max and TFL pull on the IT band, potentially causing symptoms in the knee. And as I mentioned in the case study, that there's lateral knee pain. Evidence for the tight IT band include positive Ober's test. I have a picture for you in the next slide. Evidence for tight tensor fasciae lata muscle include the Thomas test being positive, plus the thigh passively abducting caused by the tight TFL. In essence, the patient client has primary symptoms that point to TFL trigger points and IT band syndrome. So as you can see by these pictures, this is from my favorite textbook, Orthopedic Physical Assessment by David G. McGee. As you can see here, we have Thomas test and Ober's test. So with Thomas test, the leg that you're testing is the left thigh and leg. As you can see here, the person is grabbing the opposite knee, the right knee. And a positive sign, as I indicated there by the arrow, is that the thigh does not touch the table. That's a positive sign for this test. I also mentioned that with the Thomas test, that the leg passively abducts. Remember, the tensor fasciae lata, one of its main functions is to abduct the thigh, and this is the reason why the passive abduction. Ober's test, I'm showing you there with this picture from the same textbook. There's modified Ober's with the knees bent and with the leg extended, the regular Ober's. A positive sign is if the thigh does not drop towards the table, it doesn't cross the table, it stays abducted. So that's a positive sign for potential IT band tightness. And in this one, the other trigger point that was mentioned with the referral into the ischial tuberosity, the sitting bones, is, let me just move myself a second here so you can see it. So it's the iliocostalis thoracis and iliocostalis lumborum. These two trigger points, as diagrammed there, refer towards the glute and also out towards the hip, but there's a concentration of pain on the sitting bones. And so that's the other trigger point. Just going to move myself back a second. Question number 3. Explain the overall cause of your patient's presentation. So the hockey activities such as skating involves hip flexion, hip abduction, extension, has caused muscles like the TFL, glutes, and thoracic erectors to become very tight. In fact, there's also that stabilization factor too with the erectors. The sudden increase in activities have potentially caused these muscles to become overworked, and potentially the overwork has caused the muscles to become tight and have also caused these trigger points. The observations, assessment, and primary complaint point to a favoring of the right side. So for some reason, this individual seems to be maybe pushing off more with the right side, and that's causing the part of the issue. Finally, question number 4. What other strength, length, and special tests might you consider for this particular case? There's a few of them. Like here's a few. I mentioned the femoral nerve test was negative. Also quadriceps length. You might want to check that. Patrick's test. That's that figure 4 test to check for any hip pathology. Strength test, hip abduction, and strength of hip flexors. Those are a few, and I'm sure you might think of other ones that you might use to figure out what might be going on with this particular person. What is your theory as to how you came about your conclusion or conclusions? As usual, I'm very curious to hear your answers and how you got to that process. Comment below. I really appreciate it. Thank you for watching. Again, you can follow us on social media and also visit our websites, ventepainrelief.com, and also our pain relief fitness website, vprc.ca. Again, please like, share, subscribe. Pass it on to those that you feel this might be helpful for. Thank you in advance. And also hit that notification bell if you're on YouTube. Watch out for our following upcoming case studies. Keep an eye on them. Again, you can watch us on LinkedIn or YouTube. Have yourself a terrific day, and we hope that you enjoyed this case study. My name again is Alfie Vente of Vente Pain Relief Clinic and VPRC.ca. Have yourself a terrific day. Take care.